Good afternoon, everyone. Thank you so much for joining us for this infection prevention discussion today, titled How to Reduce Aerosol Exposure Risk with Next Level PPE, sponsored by AirGuard Health. Our speaker today is Dr. James Orrington. If you have any questions throughout the session, please add them to the Q&A. Speakers will not see questions added to the chat. Please note that CE will not be offered for this session. And with that, I'll hand it over to today's speaker, Dr. Orrington.
Thank you. I really appreciate it. Hello, everyone. I'm Dr. James Orrington II. Of course, with a name like that, I am a second-generation dentist. I've been in the field ever since 1980s. If you guys may know, in the 80s, dentists didn't wear gloves, dentists didn't wear masks, so as the hygienists. Back then, there was another pandemic. It was the hemoglobin pandemic, AIDS, HIV. Dentistry quickly realized we needed to make it a change to better protect the patient and better protect the doctor. So now we're in another pandemic, an aerosol pandemic. So what we did, we had to protect our patients here. So we went out, bought a lot of different products, and we know the products didn't work to like our liking. We noticed fluids were still getting past a certain barrier. We know there was still a problem. I'm going to ask you guys a question. Do you guys know the strongest muscle in the body? If you guessed tongue, you guessed right. So I noticed a lot of these studies and tests out here are using mannequin. And one thing about the mannequin, it doesn't move a tongue. The tongue is very, very, very powerful. So when you, I'm sorry about that. I think when you move the tongue, fluid splatters everywhere. And that's one important thing that a lot of these tests are missing, the tongue. Also, patients that come in that breathe through their mouth, like they even spreading it more. Even patients that are coughing sometimes hide the cough by saying it's a smoker's cough or whatever. So we needed to find a solution that could protect us still because the fluids were still going past. So that's why we started developing the AirGuard. It was a team of dentists, along with hygienists and engineers here in Illinois, came up with AirGuard. We found that to be very effective. By holding it over the patient's mouth, it grabs everything. Let's see here. So can we go to the next slide? Yes. Yes, right here. Thank you. As you may know, dentistry, we are in the highest risk factor. The reason why is when a patient come in and have a problem, you have to physically look at the problem. And when you pull the mask down, then that's where all the transmission can happen. The mouth is the dirtiest part of the body. So we needed something to make sure that can protect everybody. Can we go to the next slide? Here's some slide about my family. So when I was growing up in the 80s, I asked my dad, for an allowance. So my dad, he said, son, I'm not going to give you allowance. I'm going to give you a job. So that's what he did. I started working in the dental office at an early age. I started off as a dental cleaner. I would clean the rooms up in between the patients. And then from there, I started off as a dental receptionist. From a receptionist, I went to assistant. Then from an assistant, I went to office manager. Basically, I did every position in the dental office except a hygienist. Can we go to the next slide? So here you look at the position. When dentists work over the mouth, we're actually right or over the patient. So a lot of times we can see right down through the esophagus. So when we work in the mouth, it produces an aerosol. So we wanted to make sure we capture it and catch everything so prevent escaping out in the air. Can we go to the next slide? So the air water syringe, that is the most device that spreads airborne pathogens the most. So we wanted to come up with a solution. No matter if we use the air water syringe, it doesn't disperse everywhere. We found out that when you just put the air water syringe in the mouth, it may just flow out one direction. However, after you prep a tooth and have the actual walls, and when you clean those actual walls, now the splatter pattern is totally different. And then also I noticed our hygienist that works here, she uses a sinus scalar. The sinus scalar pattern, splatting patterns are actually different also. For instance, if you put a scalar in the mouth and just let it sit, of course, it's going to go straight in one direction or multiple directions. But once you put that scalar in the mouth against a lateral tooth, which is the walls may be convex a little bit, the splatter comes back at you at a different angle versus if you do a molar tooth. So we noticed that different splatting patterns happen when a hygienist is working on the tooth versus a dentist that works on the tooth versus a tooth that have been prepped versus a tooth that has not been prepped. And then also notice going to some of my colleagues' office who is a oral surgeon, I noticed the splatting pattern there is also different also. So it's so hard to determine exactly the direction of fluids and aerosols with actually doing real world dentistry. Real world dentistry will give you the most accurate description of how the splatting pattern goes. So this is the complex problem and we were trying to solve it. Next one. So here, as you can see, the water splatter, it goes in the tooth. And remember, after you prep the tooth and you have the actual walls, a lot of times the splatter splashes back at you and then comes back into your face. Can we go to the next one? So here, as we talked about before earlier, we're talking about the splatter. How can you protect yourself against initial sprays? Remember, sprays come back at you differently versus the Calvatron tip against a lateral tooth versus a Calvatron tip against a molar tooth versus a dental drill against a tooth that's been prepped with a class 1 occlusion or a tooth that's been prepped with a class 2 DO or something. The walls of the prep were different, so therefore the fluid splatter from the prep will come back differently at you. So what we developed a technique to grab everything as soon as it comes out the mouth and pull it away to be cleaned. Next slide. Meet AirGuard. This is the device that has revolutionized dentistry. We have used these products here and the patients love it. It's actually, this is the XP you're looking at right now. The XP is 7 tools in one. Yes, 7 tools in one. And we'll get more in depth about that in a minute. Can we go to the next slide? Here, you're looking at 2 products in one. The bottom layer is the XP. Yes, the bottom layer, I'm sorry, is the MP. There you have the capacitive touch buttons on the bottom. You can change the lights from amber to blue to white to cool. Also, we have 4 corner lights along the side. We have the spotlights also. And then that part at the top, a tablet, is actually a computer. There you have the 8x magnification. You have the audio, you have the video. Also, you can also interact with other doctors in real time. It's just a win-win situation to use this in the office. Next slide. Here, you can see we perfectly engineered it so it can be 13 feet from the mouth, giving you enough room to work underneath for the tools. Most tools go between 8 to 12 inches, so you have plenty of room to work underneath the shield and for the lights to shine into the mouth. Next slide. So here is the CFS analysis. This shows you that it grabs everything out the mouth and pull it straight up. Now, most other products out there, it doesn't capture everything. The fluid is still able to get past their barrier. So by hovering the AirGuard over the patient's head, it goes straight up and back. Now, of course, you can change the angulation. For instance, we can invert it so the shield is going in a different direction and then the fluid can go straight up and go towards it. So you can position it any way you want to. It can go straight up and back or straight up and forward or even straight up to the side. I'm actually going to show you a video of it in use right now. Can you please show the side? Here's our YouTube channel, airguardhealth.com, and we're going to show you the slide right here. So here I'm just talking over it so you can see it. Here I have my IQ unit. The IQ unit is one of the units I brought. Very great unit. I've been using it nonstop for a year now. No problem. Never had a problem with it. It runs so quietly. The suction pull is magnificent. So as you can see, as I'm working, you can easily see her lips getting wet, and the fluid is literally going straight up and back into the shield and then pulled into the AirGuard to be cleaned by the IQ unit. Now you can easily position the AirGuard in different directions. Our hygienist, Tina, she has it in a different direction. She has it coming up over the stomach of the patient and going up towards the face. Sometimes I even have it on the side of the patient, so it can pull straight up and go to the left of the patient. So it's either way how you want to do it, but pay close attention to that bib. If you look at the patient bib, hygienists would tell you those bibs always are soaked with water from fluid spatter from the solid scale. And as you can see, I don't know if you can tell, the spray is different on different teeth. And then sometimes that mirror may get in the way, and sometimes the splatter may come off the mirror. That's the reason why they should do real world testing, because a lot of times when you do it in a clinical setting or in a laboratory, and when you use a mannequin, you don't get the real world results. The reason why is sometimes patients use their tongue. That tongue can easily get in the way. Sometimes patients move their head. Sometimes patients cough. Sometimes patients are just mouth breathers. This is the solution for all those complex problems. Here you have a physical barrier that will protect you, and you don't have to worry about all those fluids coming back at you. Next slide. All right, here we go. So how does the AirGuard protect patients and dentists? It's a reusable, recyclable, invisible barrier that basically effectively grabs everything, pulls it away to be sucked in to be clean. Also, we have different versions for everyone. We have the low cost model, which is the LT. That comes in right now, 3 different versions. The LT comes in the version that you can attach it to an IQ unit. It also comes in a version when you can attach it to the back of the chair. It also comes to a version when you can attach it to the ceiling, also an arm. So there's many options for the LT model. Now the other model, the MP, we also have that on an arm. You can hang from the ceiling. That could be used to help you also protect against any aerosols, any bad fluids, or anything like that. Can we show the other video so I can show them the MP? And this is the upgradable version to the LT. The other video. There we go. Yes. Now this is a very important. Please listen to this video. This is the MP.
Hey you guys, welcome here to the AirGuard station. Here we're gonna do a first person view as if you are actually looking through the MP. I think this would be a good way for you guys can see the future of dentistry through the camera eyes in real time. So here, as you come up, you'll be looking through the screen. You have multiple buttons here for the lighting fixture. Here, these are the lighting strips, and here, these are the corner lights here. And you can see how much brighter it is. All right, ma'am, can you open up? All right, so you can see how it looks with the light off. And then if you aim, let's say a regular overhead light, I'm gonna show you the difference. This is an overhead light, very minimal, but however, the 4 corner lights up very beautifully. And then you can add more lighting to make it even brighter. Okay, so here I'm going to show you, I'm going to continue on and actually start doing some braces on her teeth here. Well, not braces, but just changing the ties on her braces here. It's very easy to do. Now, as I'm doing this, I'm actually looking through the camera you guys are seeing. So this is something like the XP kind of. The upgradable version to the MP. Open the water, sweetie. Thank you.
So we can stop the video. I just wanted you to see a few minutes of it, and so you can see the MP. Like I said, the MP can easily replace the old overhead dental light. The dental light hasn't changed in 100 years. In this new environment, we need something that can protect us. And the old dental light doesn't do it. So we can replace the new dental light, replace the old dental light with the new dental light, which is the MP. The MP can act as a barrier to protect us against any fluids coming back at us. Also, we have integrated lights in the MP. Also, then you can get the upgradable version of the MP, which would be the XP. The XP has 7 tools in one. It has a camera, video, it also has audio, it has HD camera. I think I said that earlier. It has also the aerosol barrier. It's also lighting, curing. Also, it has a camera inside of it also. Can we go to the next one? All right, so here are the different versions. Well, here is the verses basically. You can see the advantages over an AirGuard versus an air purifier. So as you know, the air purifier usually sits in the corner. It does clean the air, but it doesn't capture or block initial sprays from the mouth. Remember, that tongue is in the way a lot of times, and that tongue can easily push fluids in a different direction. And also, when you prep the tooth walls can easily move the fluids in a different direction. All right, now let's look at the next thing. Now, will the air purifier capture and pull the aerosols away immediately? The air purifier does not, but however, the AirGuard does. One thing of advantage about the AirGuard, it blocks, captures, and pulls in at the source. So this keeps your operatory clean, keeps instruments clean, and keeps other bays clean if you're in an open setting like a dental clinic in a hospital, or dental clinic in a dental school, where you may have 100 chairs, and then each chair has 100 patients in it. This is the best way to capture aerosols at its source, for capturing it and pulling it in, not letting it get out into the room. Can we go to the next slide? This is another reason why we need AirGuard in operatories. When you use soft tissue lasers on the face or anywhere in the body, it could be with a dermatologist, or it could be even, a dentist. We use lasers just as the dermatologists use lasers. There's a plume that's released. That plume could be harbor many of different negative or bad pathogens that can hurt your respiratory system. So the AirGuard captures that and then pulls it in to be clean also. So this is another advantage of using the AirGuard to fix this solution. Next one. So this is a slide. How can patients help everyone be safe in the office and keep everyone safe, the dental staff also? Next one. Here, you need to educate the patient, and how you do that is, if you're sick, stay home. You think you have a cough, isolate for 12 or 14 days. Try to advocate for the vaccination. A lot of people are still resistant to get the vaccination. I'm still telling them that's the best way to protect yourself, protect your family, protect your loved ones. I tell them, please get the shot. Please, only way we can get through this is everyone get the shot and try to protect everyone, so this is the only way. Next one. So here's a couple of things you can go over with the patients, go over them getting testing done. You want to ask, if they've been to a hospital or if they travel to a hot spot. If they have, you want to tell them maybe, put off dentistry for a little while and stuff like that. But, you do have patients that will deceive you. We had a lot that came through here at the start of the pandemic. They was in pain, and then they were also sick. So best way to protect yourself is, the AirGuard, which also will help you, or any engineering control. You need something just in case the patient may come in and they know they're infected. You need some type of engineering control to protect yourself, the staff, and the patients, or the other patients. Next one. So basically here, what I said earlier, the AirGuard is here for you just in case the patients may not tell you the truth, just in case they are sick, because there are a lot of symptomatic patients that don't know they have the virus and then they're spreading it on to you. The next slide. Here, I'm gonna let you guys know I do have a partnership with IQ Air. That is the first company I went to with my product, and also that's the first product I bought that really was somewhat effective against aerosols. There's a company that's been around since 1953. They're a great company. They're in 100 countries. They are the leaders of air quality for your home also. They just believe in quality air and they have quality products. So I do highly recommend IQ Air. Next one. Here, AirGuard's here for you guys. So if you have any questions, I'm here for you. Thank you. Oh, thank you. I appreciate it. Thank you. Let's see. Do we have any questions? I'm here if you do.
We do have some questions. Let me grab them for you really quick.
Oh, okay. All right, great. All right. Is this clean after every patient? Oh, of course, of course. We have a solution you can clean it with. I spray the inside down, and then we use a soft cloth. I wouldn't recommend a paper towel because you can scratch it. But it is reusable, recyclable PPE. I like to call the AirGuard OPE, office protection equipment, because it really does protect everyone in the office, just not you. Let's see the next one. The cost. All right, great. So we have right now, I told you, 3 different versions. We have the LT. The LT comes in 3 different versions right now. The LT comes with IQ unit. That roughly costs around $100. Then we have a version that attaches to the back of the chair. That version can be used as a spit guard, splatter guard. When we was in Atlanta, we met a dentist over the prisons in Florida. We discussed with him and he told us his concerns. And that's the reason why we made the chair model, because sometimes you just need that extra layer of protection. So we have a chair model. That chair mount will go for $150. Now the MP, right now we're looking for the MP ranges between 1,000 to 2,500. The reason why is the MP is multiple tools in one. It has the regular lighting, it has integrated lighting, it has the amber lighting, it has the blue lighting, and also it acts as a barrier. So right now, the cost for the MP is between 1,500 to 2,500. And those doctors that want the high end, such as the XP, that has 7 tools in one, such as the video, the audio, the camera, the lights, the curing, the computer, and also the suction if you want it. That may go a little bit higher. You're looking at 3,500 to maybe 4,500 for that piece of equipment. That was a good question. Next one.
It actually doesn't look like we have any additional questions.
Oh, great.
Those were the 2 big ones.
Great.
Thank you so much, Dr. Orrington, for this great session. And thank you again to AirGuard for providing today's session. Again, there is no CE code for this session. CE is not being offered. We now have a 15-minute break before the presentation on controlling infectious aerosols. Thank you so much for attending, everyone.
Thank you. Bye-bye.